Good afternoon, class, and welcome to part 2 of Arterial Lines. If you remember from our first class, we initially went over the who, the what, where, when, and why of arterial lines, and today we're going to go ahead and take a look at the how. So in order to understand this, I just want to recap what we went over in the first class. So what are our components of an arterial line? The first thing is the A line itself. You have your catheter along with your guide wire to allow for easy insertion. Once your arterial line is in, we're going to hook that up to our pressure tubing. The pressure tubing is set to 300 millimeters of mercury, and the reason for this is because your patient's blood pressure will never get above it. So it will never be able to exceed the pressure that's being forced down. If you follow your tubing down, you then go to your transducer. And remember, your transducer converts your physiologic waveform into an electrical waveform. So this is what gives you your numbers on the actual monitor. You also have your cable that goes to your monitor itself. And then when you go down to the end, you have the connection to the actual arterial line. Of note, these two little white clips here allow you to flush the system manually. So if you go ahead and look at the end, you're going to see some saline come out. So this is going to allow you to constantly have a nice patent system. So we have our arterial line set up. So let's take a look at the two things that make up the how of arterial lines. And these are the concepts of zeroing and leveling. When you zero your arterial line, you are basically allowing the transducer to see atmospheric pressure. We want a starting point for the measurement of your arterial line to be, and that is atmospheric pressure. It is 760 millimeters of mercury. However, up on your monitor, it will come up as 0. So in order to allow this to happen, we need this nice stopcock to turn off to the patient. And since this side is going to the patient, we're going to go ahead and turn it off. And then we need it to be open to air. So we're going to go ahead and we're going to theoretically take that yellow cap off. So now your transducer, you have a nice clear line going through it into atmosphere. You're going to go ahead on your monitor and push a nice convenient 0 button, and you should get a 0 up on the monitor. If you do not do this, you're going to get a bunch of question marks. So it's very good to 0 before you insert, immediately after insertion, and at least every 8 hours to ensure that your measurement is accurate. So that's our zeroing. The next step we're going to do is level. And in order to level your arterial line, we need to look at a point called the phlebostatic axis. So let's go take a look and see what that looks like. So here we have a nice picture of where the phlebostatic axis is in relation to your patient's heart anatomy. Now your phlebostatic axis, we basically use it as a reference point. It approximates the level of your right atrium. And in our facility, we actually use the patient's arm to allow us to level the transducer at that point. You can also have it on a separate holder, but we, for convenience, put it right on the patient's arm. So again, to go over it, we are looking at our 4th intercostal space, mid-axillary line. And once you approximate that level, you can go ahead and tape it up. That way, no matter where the patient is, forward, back, side to side, they're always going to have an accurate measurement. So we have our zeroing, we have our leveling. We should have beautiful monitors up, or numbers up on the monitor. So let's go ahead and take a look at that monitor and see what we have. So here we have a great arterial line waveform. It is the red waveform that you see on the monitor. And you can see on the right-hand side that her blood pressure right now is reading 127/63 with a mean arterial pressure of 84. So what does this waveform actually mean? What is it telling us? If you look, there are 3 different points on the waveform. There is a high point, there is a middle point, also known as the dichrotic notch, and then there is a low point. And this is repeated with every heartbeat. What the high point is your systolic blood pressure. So this is your aortic valve opening and blood being ejected into systemic circulation. Once that pressure starts to decrease, the next thing we see is our middle point, or our dichrotic notch. And our dichrotic notch is actually the aortic valve closing. So this may not be seen in all patients, but it is definitely something to watch for. And then you have your low point, and your low point signifies your diastolic pressure, or the lowest reading. So if you were to look at the numbers on the waveform and not have 127/63, you would still be able to figure out this woman's blood pressure just based on the actual arterial line waveform. Okay, so we have now gone over the who, what, where, when, why, and how of arterial lines, including leveling, zeroing, and waveform interpretation. If you have any questions, please bring them to next class, and I'll be more than happy to go over them. And we're also going to be talking about troubleshooting of arterial lines. So have a good week, and I will see you next class.